10 signs your dog is asking for help. When your pet dog is a loved family member, you want to do everything you can to keep it well and secure. While vaccines and vet appointments are necessary, there are other things to watch for in between visits. The last thing you do not want is your dog to become ill because you ignored a warning sign of a more severe condition. To know 10 signs your dog is asking for help, keep watching. Number 10. Change in eating habits. Any changes in how your pet dog regularly eats demands going to the veterinarian. If your canine suddenly turns up its nose at regular meals or treats, it can signify anything from digestive troubles to a significant gut blockage requiring treatment. Number 9. Drinking a lot. Not drinking plenty of water or not peeing normally can also indicate intestinal difficulties. If your dog is consuming and urinating excessively, a veterinarian should check it for diabetes or renal problems. Number 8. Difficult or rapid breathing. Illnesses in any part of the respiratory system and illnesses in other parts of the body can cause breathing problems in dogs. The nose, mouth, throat, windpipe, and lungs are all respiratory system parts. Air is drawn in and transported down into the lungs through the nose or mouth, a process known as inspiration. Oxygen is delivered to red blood cells in the lungs. The oxygen is subsequently carried by the red blood cells to the remainder of the body. Carbon dioxide is moved from the red blood cells to the air inside the lungs, while oxygen is supplied to the red blood cells. It is ultimately discharged by the nose or mouth, known as expiration. The distinction between a dog with normal breathing and a dog who has difficulty breathing is not always as clear-cut as you think. At rest, healthy dogs must have a breathing rate of 20 to 34 breaths per minute and should not look struggling to breathe. Of course, dogs can breathe more quickly or deeply in reaction to typical stimuli such as heat, exercise, stress, and excitement. Before any health issues arise, owners should know what is usual for their pets and consult a vet accordingly. Number 7. Vomiting or changes in stool. Your dog will experience diarrhea or vomiting at some point in its life. It's not avoidable. But when it happens, it's essential to know how you can help. If your pet vomits or has diarrhea, you should stop feeding it for at least 6 hours. It is also called gastric rest because it relaxes the gastrointestinal system. During this time, you can provide modest quantities of water to help them rehydrate. Following an incident of vomiting or diarrhea, it is a good idea to give your pet some bland food for a couple of days. It is better to serve smaller meals more frequently until your dog returns to normal. You can then progressively reintroduce their regular diet to them. In most circumstances, your pet will recover without issue. There are occasions when vomiting and diarrhea become more serious and you should take your pet to the veterinarian. If your pet vomits more than once, has several episodes of runny diarrhea, has blood in their vomit or stool, appears lazy or tired, or has a decreased appetite, you should consult your veterinarian. Number 6. Lack of energy or lethargy. We know dogs to be incredible fluff balls of pure energy, so you may not be used to seeing them sluggish. So if they appear that way, it's a symptom of lethargy. A sluggish dog can show little interest in going for a walk, although it is usually the center of their day, or they can refuse to play or eat. Lethargy in dogs can be caused by extreme weather or when it's had too long a walk. However, it can also be the first indication that something is wrong with your dog. Lethargy, weakness, and sudden exhaustion are frequent symptoms of sickness in dogs, but they are somewhat ambiguous. A variety of issues can cause your dog to look sluggish and weak. As your dog ages, it can become increasingly sluggish. It could be due to arthritis or other age-related ailments that cause discomfort or intolerance to physical activity. If your dog is young yet suddenly lazy, aimless, and sluggish, it could indicate a more severe condition. It's especially true if a lack of eating or drinking accompanies it. Either way, you should seek guidance from your veterinarian. Number 5. Poor balance or difficulty with regular movement. A dog that unexpectedly loses its sense of balance is experiencing disequilibrium or can be suffering from a significant health condition that needs immediate veterinary care. A dog's lack of balance is, among other symptoms, indicating a significant health problem involving the neurological system. The vestibular system's function is to maintain balance. The vestibular system comprises the middle and inner ear. many big cranial nerves in the brain. Disequilibrium refers to a loss of balance. Trauma, middle ear infections, malignancy, and poisoning are some of the most prevalent causes of disequilibrium. In older canines, disequilibrium is more prevalent. You must recognize stability issues or any trouble walking. Difficulties walking can be neurologic or orthopedic, resulting from a nerve or muscle dysfunction. The two can be hard to distinguish, and you should visit your veterinarian if you are unsure. Loss of balance can be followed by additional symptoms such as a head tilt, uncontrollable eye movements, efforts to walk in a circle, or vomiting. Walking with difficulty is more likely to result in delayed or incomplete motions. Please keep your pet secure once you've determined that it suffers disequilibrium. You definitely want to keep them away from the kitchen, staircases, the pool, and sharp corners. Number 4, irritated, weeping, or red eyes. Dogs, like humans, can get eye problems and irritation. Bacteria and viruses can infect your dog's eyes, and irritants can cause inflammation. It's essential to consult with your veterinarian to determine what's causing your dog's eye infection. They can assess if there is some underlying disease that caused your dog's eyes to become infected in the first place. It is critical to provide adequate treatment and care for your dog's eye infection or any underlying problems to protect your dog's comfort and eye health. Abnormal discharge or eye boogers from one or both of a dog's eyes can be seen. If the discharge is thicker than usual, colored white, yellow, or yellow-green, or even if there is much more discharge, consult your veterinarian. Symptoms can include redder eyes than usual. Because eye infections are frequently itchy or uncomfortable, you can see your dog scratching at their eyes or dragging their face around your floor or furniture. Number 3, rashes or skin and hair changes. Changes in a dog's skin color or coat texture can indicate several common metabolic or hormonal issues. They can also be caused by an infection or skin problem. A simple blood test can usually pinpoint the underlying problem. You should report any substantial changes in your dog's coat to your veterinarian. Rough, flaky skin can be an indicator of a variety of issues. It is a frequent sign of allergies, dermatitis, and other skin conditions. However, most of the time, dry or flaky skin is not a significant problem. Make sure your dog is eating high-quality food. Some dogs, like people, suffer from dry skin in the cold. Consult your veterinarian if this appears to be causing your pet distress. Inquire if a fatty acid supplementation or a humidifier could be beneficial. Number 2, wincing, whining, or crying. Dogs cannot communicate verbally, but they can engage with us via various means. One of such tactics is whining at times. Whining can be adorable, but it can become irritating if it continues for an extended amount of time or becomes a habit. To stop your dog from crying, you must first understand why it is doing so. The most basic reason for your dog's whining is that it requires or desires something from you, such as food, water, or a walk. Perhaps its favorite toy is stuck behind the sofa, or the cat has taken refuge in its bed. When you've identified and fixed the problem, the whining should end. Dogs will sometimes cry if no one is paying enough attention to them. It is comparable to how small children whine when bored with the adult conversation at the family dinner. Your dog is looking for someone to play with or something to keep it busy. Wincing can be your dog's method of expressing fear or anxiety. If your dog is pacing, shaking, or panting while whimpering, it is probably afraid or nervous about something. Perhaps your dog is frightened because there is a new visitor or resident in the house, or it seems concerned because someone has gone missing. Moreover, whining can indicate that your dog is in bodily pain. If it whines every time it goes up the stairs or jumps on the sofa, it can be suffering from arthritis-related joint aches. Number 1, aggressive or unusual behavior. Most dogs act aggressively when threatened, in distress, or striving to establish dominance. An aggressive dog can bark, growl, attack, expose its teeth, or even bite. Because their aggression can quickly get out of control and cause damage to animals and people, it's necessary to know the source of the problem. What's making them so disturbed? It might not be what you think. This behavior could be caused by pain, an illness, injury, fear, possessiveness, frustration, or a way to show dominance. Once you figure it out, you can tackle the problem right away. Have you seen any of these signs in your dog? Share it with us in the comments below. And as always, if you enjoyed the video, make sure to hit the like and subscribe button. Thanks for watching.